Privet Katila Wandingruski desu. So today I wanted to make a video on America's healthcare system, which, I'm going to be straight up with you guys, for the most part, plain old just sucks. And it's a stain on our country and a drain on our people. And in this video, I want to briefly look at what the American healthcare system even is, what are the problems that this system has, provide a right-wing framework on why we need to provide a public healthcare plan to help fix it, and then I hope to go into the details of what this plan would even look like. So without further ado, let's get right into it. So, the reason why I'm focusing on healthcare policy for the right wing is that simply the right-wing version of healthcare reform does not really exist in any sort of real fashion. It's not even like I can debunk it or break it down. It just simply does not exist in a comprehensive fashion. You can summarize it by basically saying, repeal Obamacare and inject the free market into healthcare with state lines or some crap like that. This not only does not fix the problems within our current system, but this weak-ass message has given the Democrats total control on healthcare, and voters respond accordingly to this. Healthcare is one of the top issues for voters, and it is especially important as of the making of this video with the coronavirus. Healthcare, you could argue, was one of the biggest reasons the Democrats won in the midterms in 2018. Even the newest face on the right wing, Madison Crawford of North Carolina, who said, he's like the Aryan dude who's 25 years old. He said his biggest issue is healthcare because he broke his limbs, he's on a wheelchair, and so he wants to give a conservative case for healthcare. And what is it? Does he have something? Well, the most he can provide is some vague references to competition and free market solutions and opposition to socialized medicine. So the right wing has no real concrete healthcare plan, and in this video, I hope to fix that. Before we begin, I'm going to go briefly how the American system even works. I'm going to be brief, I'm going to skip a lot of details, but this is just the core of it. So the core of the whole American system is that individuals have to privately get private-based healthcare insurance, with a majority of people getting private health insurance from their employer, aka their job. So there's thousands of different types of plans offering different benefits, different cost structures, different ways you pay, and there's a whole network system which is set up with all these different insurance plans, which determines, which hospitals you could go to, which doctors are covered inside it. So there's this whole complex thousand of insurance program that is tied to your job and all that type of stuff. But setting aside that complex web of private insurance, there's also the government healthcare programs that exist, which are also about as complex. There's Medicare, which is healthcare administered for old people, and even in Medicare, it's broken down to A, B, C, D. But Medicare in general is supposed to cover old people. Medicaid, which is a mostly state-based run program for poor people. You also got healthcare plans that are given to politicians and public sector workers that the government pays for, and you also got CHIP for children, and you got a whole other department dedicated to the military. So all these programs, regulations, rules make for a needlessly complex system that is letting us down. But how exactly is this system letting us down? So there are goals that are within a nation that are just accepted as standard barriers if you're doing things right for your country, that are that everyone agrees is objective to saying, yeah, that nation's developed. For example, literacy level. If, say, only half your population is literate, we just assume you're a failed backwater. Or another metric, how about clean water access? Can you get, clean water into your home? Well, if most of your citizens can't, then we would say you live in a backwater. Well, in the realm of healthcare, in terms of what a sane, civilized country would produce, America is almost like a backwater. Well, how? Well, the number of uninsured adults, meaning adults with no healthcare coverage, stands at about 13.7%. That's right, 13.7%, or in real numbers, this is above 30 million people who just have no healthcare coverage at all. Now, to me, that's strike one, you're out. And when we expand this to the number who are underinsured, meaning while on paper they have insurance, the deductibles and the out-of-pocket costs and premiums are so high they are practically unaffordable and worthless, that number stands at about 23% of Americans. Because of these statistics, it is estimated that over 30,000 Americans die each year because they lack access to basic health care. So those are that's the truth about this country, and it's just mind-boggling for me. You can't say we live in a sane country when you have a wide swath of your population that just has no healthcare coverage at all, or leaves them in crippling debt because of it. Now, if they even do have insurance. Now, another thing we need to talk about is the grossly costly nature of this healthcare system. Maybe we can't afford it, I hear you say. Well, as a nation, we spend about 18% of GDP per capita on healthcare. What is the OECD average? About 9%. Germany spends about 11.5%. The UK is at 10%. Italy is at 9.5%. And Japan is at 8.5%. The closest nation to us is the Netherlands, last time I checked, at 12%. This is compared to us at 18%. And this translates to about $3.6 trillion as part of the healthcare economy. This is such a grossly mismanaged and costly system. But does this at least give us good health outcomes? Well, first, tens of millions of people aren't even covered, unlike the other nations that do have everyone covered. And second, no. From, from life expectancy to infant mortality, we are on the lower average end in total health outcomes. The cost is not worth it. In terms of that's the societal level. In the personal level, that unlike other nations, which people don't really spend almost anything on healthcare, from their own pockets, I should say, the average family spends about $12,000 a year on healthcare. On healthcare insurance alone. And if, say, they have no insurance, or they went to the wrong network, or the insurance finds a way to weasel out of the health expense that, for the surgery, a surgery could end up costing over $100,000. Or maybe before the insurance can even start paying, they're like, actually pay $20,000 first, and then we'll pay it. It's like, what? I thought I was paying you for years, and then once finally I need you, you're gonna leave me like this. So it's. Health insurance, the purpose of health insurance is to make money. If you pick up every single claim, you're going to be bankrupt as a private health insurance. So obviously they're going to try to not pay for you. So we overspend from our own, and this might be an explanation why healthcare debt is the leading cause of bankruptcy in this country. So we overspend from our own pockets. Families overspend from their own incomes. We overspend on a governmental and societal level. Another example of this overly costly system is prescription drug prices, which are 4 times higher on average than in other countries. And just as a personal experience as someone who does travel a lot, or at least did before this coronavirus thing, the same exact prescription or surgery or checkup in a country like, say, Belarus is much more cheaper than in America. And the services, just from my own experience, are about on par. So, it's not like, they're just getting shittier healthcare or it's less available. No, it's for my experience and from what the data say, it's cheaper and the quality is about the same or even better in some cases. So, where is this extra cost coming from? We need to deal with this cost. So another problem that we have is the crushing complexity that is crushing individuals and businesses. As mentioned before, there's a giant network system within insurance that determines who you can see as a nurse or a doctor and which hospital or clinic you can even go to. Going outside this network system makes you not covered by the insurance, and this crushes choice and freedom for the patients. Along with this, it's a burden on the hospitals and doctors themselves who have to navigate the complex administrative system that comes with, going through these thousands of private insurance plans and everything, which basically creates a giant part of the current bloat within our current system. Also, as mentioned before, providing job-based health insurance is one of the biggest expenses for small businesses and prevents them from expanding and hiring. This also hurts the employee because if their insurance is tied to their job, then getting fired from that job means you lose your income and your insurance and prevents you from seeking out other lines of work out of fear that you will lose your health coverage. So much for choice. This is especially prevalent for now because of the coronavirus where, tens of millions of people lost their jobs because of the coronavirus and now they don't have healthcare in a pandemic. Seems like a pretty screwed up system if that happens in your nation. If I had to say it. And then another problem that comes from from our current healthcare system is the giant complex bureaucracy with a wide array of healthcare programs, countless examples of tax breaks, tax laws, and just general regulations regulating health insurance and health costs and health access and health affordability, etc. This is purposely making us having a more complex tax code and a more bureaucratic government. So we now know that the problems with America's healthcare system. It's leaving tens of millions without coverage and tens of millions more with insurance that will bankrupt them. It is a giant financial strain for the government and for the average individual and family, costing us trillions. It restricts our choice in who we can see and what hospital to go to, while crushing businesses with healthcare costs. Our government and our tax code is being needlessly complicated, and we are at the mercy of this complex administrative system that is costly and tries to get us and is trying to get out of paying for our treatment in every single way, because I don't blame them. They're trying to make a profit, but, it's not helping the nation or the people. So why should we as people on the right, on the right wing, even care about this? So on a right wing point of view, we can approach this from two different angles. In my version of what it means to be a right wing, aka a national conservative and right wing populist direction, and then there's also the libertarian point of view. So to keep things simple, in my view, the nation is like a unique and strong family. So if you're a nationalist and care for the well-being of your people, you should be in favor of a healthcare system that makes sure that our people do not get into debt just simply because they got into an accident or got sick. We want a strong and healthy populace. It is within Christian teachings and for the sake of taking care of our own fellow countrymen that we must unite and create a healthcare system that provides for those who end up being sick in our society. In a decent society that claims to care about its people and its nation, we must embrace a healthcare system that covers everyone with high-quality care, while at the same time striving to give them the choice and security and privacy in their own healthcare matters. Healthcare companies should work for the national interest and the common people, not just for their own profits. Along with this, so that's my version. That's why I believe in a public healthcare system. And now, there's also the libertarian case. Now, I'm not a libertarian, but why should libertarians care for this public healthcare system? Well, instead of why this would be better than the alternative is because instead of continuing this Byzantine system of our current healthcare system, we can simplify the federal bureaucracy and actually simplify overall government spending. And this also gives more choice and freedom to the individuals, which would ironically come from our public healthcare system. So those are the two arguments I lay out for why the right wing should embrace a public healthcare system and fix these problems that I laid out. So, how would a public healthcare system for America look like from a right-wing populist point of view? So, first, it would consolidate every single known government healthcare program. I'm talking Medicare, Medicaid, CHIP, all the government healthcare plans for Congress and public sector, workers, everything from the Obamacare exchange and all the regulations that come with it. All of it would basically be consolidated. Anything that is unnecessary would be eliminated, and it would be basically put into a singular, simple program, which I call Americare. And why that? Well, instead of Obamacare or Trumpcare, which represents, I think, a politician trying to dangle healthcare in front of people for personal political gain, this healthcare system is strictly for the betterment of America and her people. So this new Americare program would cover every single U.S. American citizen. No illegals or visa holders would be eligible to be in this system. So they have to the illegals will be deported. The people who are on visas or are green cards, they have to get from a private insurance system. So in order to utilize such a system, every citizen would get an Americare card. Sort of like how we all have like a social security card, for example. And this is strictly for American citizens. So basically what happens is that whenever you go to a doctor, you would show them your Americare card. And if you're incapacitated, the doctors would just look you up within the telehealth system because you'd be in the program. Kind of like if they get your social security number, they could just find you on their system. Be kind of like that. And then their billing would go to the Americare, department. So this singular program would have a set of benefits, and that they have a set amount of prices that are negotiated, and would have a set amount of regulations that are imposed upon the health insurance market that would cut out waste and red tape. So let's start clean. What is the set of benefits that Americans would get? Catastrophic care, primary care, ambulance care, preventative care, and full maternity and neonatal care. Now, for that last benefit, which that, if you guys remember, this was part of my family program, which I outlined a few videos ago. No mother who has a baby should have to spend any money to bringing a child into this world. So everything that I just mentioned, these services are fully funded. You don't have to pay anything. If you have to, so everything I listed, there's no price. You just, you go in and then it's paid for. Now, additionally, the next few benefits would either have a few cheap co-payments or be split with price, such as, for like a cost-sharing program. So, like, for example, the government would pay for 70% of it, and then you would pay for 30% of it. Now, it's not, like, completely expensive because the government negotiates down the price, so it wouldn't be too expensive. Now, the services that are for these are things like mental health care, prescription drugs, vision care, dental care, substance abuse, and long-term care. And what services are just not covered at all? Things like cosmetic and elective procedures would not be covered, along with certain like voodoo types of medicine, like stuff that is like just kind of like wacky things that are unproven, things of that nature. That isn't covered in the Americare healthcare system, the set of benefits that it provides to American citizens. This would all be financed. So how would this be financed throughout, like, if there's not, like, if it's not just individuals, buying things on the private market? Well, this would be funded like a payroll tax, like how you pay for Social Security. The way I'm not a policy expert. This is what I have right now. It could be lower. What I'm doing is a clean 5% for the employee and 5% for the employer payroll tax that kicks in for everything you make over $30,000. Why that percent number was chosen? Because everyone chips in and everyone can utilize the healthcare program. It creates a sense of solidarity where it's not high enough where people without being so high that people pay more in taxes than they get in benefits. What happens is that it kicks in at it makes higher income individuals pay more, but for the vast majority of Americans, like 95%, they would basically be saving money because they don't have to pay for private insurance anymore. All their benefits are mostly covered, or if whatever is there is more cheap. And in exchange for everything they pay into the current system, a part of that would go back into taxes, but they would save more than they would pay in taxes. So that's why it's that small, because it helps fund it, but also it's not too high. Along with this, since all Americans who want it are enrolled into this healthcare plan, the government would negotiate directly with drug companies and healthcare companies to clamp down on abuse and price gouging. This would end the absurdity of us in the United States paying more for services than any other nations, and this would also, because of the more simplicity of the whole thing, cut down the amount of on administrative costs, which is one of the biggest reasons for bloat within our current system. It would also cut down a lot of on like executive payments for private insurance companies in terms of like marketing, or things like that are within like a private enterprise that most governments don't have to worry about that type of stuff. It's also more efficient. And that's what I mentioned before. The reason why costs are so low in other countries is because the government, while ensuring everyone has a hand in negotiating cheaper drugs and cheaper healthcare costs and such like that. So the power of the state would reduce healthcare costs. That's another way we would pay for it. What's another way we could pay for it? Well, in terms of the costs would be set by Americare, and for, say, drugs, they would be negotiated down. Right now, they're prevented from being negotiated down. Another thing we could do is that we could peg the costs of prescription drugs to the costs of other countries, such as maybe Canada and Britain and Japan or something like that. And then another thing we could do is allow Americans to buy prescription drugs from Canada. What's another thing we could do to reduce prices? We could get rid of all the loopholes within our current tax code, like the employer healthcare deduction. This would raise about $230 billion a year. Right now, this is an archaic tax thing that is trying to make sure people could somehow get some sort of healthcare through private insurance, but it just makes the whole thing a big mess. Since this is all going to be done through a national plan, this isn't, people don't need help on private insurance anymore. So that would get eliminated. It would simplify the loopholes and deductions within our tax system, and that would raise more money. Another way Americare would be able to cover America's health cost would be from general income taxation. That would hit more higher income earners. Now, I wouldn't take all the money that is raised through more progressive income taxes to healthcare, because that could be used for other things. But a portion of it, that's another way we could raise money if we don't have enough. I'm not a policy expert, but basically, the way I see it is that all income made over $1 million is taxed at 45%, and then all income earned over $500,000 would be taxed at 40%. Another way we could finance this program, as mentioned earlier, is through cost sharing and co-payments, where higher income individuals will pay a small share of the healthcare costs. Now, I'm not set on the details, but let's say you want to get treated for substance abuse. If you're well off, you would pay. Let's say you would pay 20% or 30% of the cost, while the government picks up the rest. And then we could also talk about maybe if you're in a certain class, like say if you're a kid or you're you're old, this is waived. But then things like primary care would be free for everyone. So you see the difference. And then in terms of co-payments, this would stop overutilization of the healthcare system. So like, for example, if you get a prescription drug, it would cost like $10. So it's like, if you need a prescription drug, you'll get it. And, again, we could determine which people are exempt or poor people exempt from this, co-payment. We could determine the details, but generally, this is a way we could raise money as well. So again, this is, but again, this is like, that this gets just a tiny bit complicated in terms of just making sure that they certain. But the benefits I mentioned beforehand, the primary, like primary care, ambulance care, catastrophic, etc. You just go in, you get they check you, check who you are, you get fixed, and then you get sent on your way. There is no payment for that. So there's like kind of two sets of tiers of benefits in a way. It's like Americare Part A and Americare Part B, you could say. So that's how you would finance this whole operation. So one question that probably is going to come up for this healthcare system is that what is going to be the role of private insurance in this system? Well, they would be regulated with clear rules and regulations from the national body. However, they would still exist as a private option for individuals to use, unlike single payer, for example. So, private insurance can be utilized by more wealthier and well-off individuals to afford more exotic and quicker and alternative treatments and medicine. So, it would be like the private versus public school debate in America, where everyone gets an education. However, if you want to go to a different school that might have different ways of learning or might be better of quality, you could go to a private school, but the government isn't going to pay for you to go to a better school. They're like, we have a public school that's going to teach people basic stuff. If you want to go somewhere else, that's on you. But everyone gets an education. This would be applied to healthcare. So Americare would give all Americans a free to cheap insurance option, and private insurance would be there for more high quality and quicker treatments and such. Private insurance could also be utilized to cover the extra fees and payments that I mentioned earlier, and could cover procedures that aren't fully covered by America, such as as I mentioned, like maybe mental health care, for example, or something like that. Along with this, private insurance would be mandatory for foreign visa holders and green card holders to get, if they wish to visit or live or work in this country. So unlike single payer, there is still a wide variety of options that someone can use to get healthcare and private insurance. Then there's just what Americare is that it provides a public healthcare plan for everyone. And if you want to get something more quicker or more exotic or some better care or something like that, then there's a private insurance option for you. Also, as I've talked about Americare in terms of like the consolidation and that way we are financing it, and the way the benefits are administered and all that, and private insurance. So while this all sounds like something that's happening at the national level, what also a lot of a good chunk of healthcare policy and public health policy would also be devolved for state governments. So these laboratories of democracy would operate in terms of our healthcare system like a German or a Dutch or a Swiss system, where healthcare is local and leaders at the state and county level, know what needs to be done in terms of healthcare for their residents and all that. That maybe a national government might not understand. you see this in states that are kind of like America, like Germany, where a lot of it's devolved, and there on a state and county level, and then they kind of figure out what needs to be done, and they could customize their approaches for the needs of the local citizens instead of a one size fits all. So what they can do is they could work out ways to provide greater access to healthcare, such as ways to help out rural folks or poor folks. Perhaps the state, and maybe those state government wants to cover more than just what the America covers. Maybe they want to cover substance abuse for being totally free, so they can add what extra benefits they want. They could introduce practices at the local level that can root out waste, fraud, and abuse, and they could also be involved in health policy outcomes that other states can see and utilize if it works. And plus, from a local perspective, this gives states the ability to provide health care and make things personal, such as pairing up doctors for seniors in their homes or opening up clinics in a poor neighborhood. These personalized local devolution of healthcare power would greatly improve the system, as a whole. Along with this, states would also be able to communicate and cooperate with each other in terms with telehealth and work together with healthcare statistics and outcomes to see which common practices would work better for everyone. And having it more local would allow doctors and nurses to focus on patients in their local communities instead of being paper pushing and facing bureaucratic nonsense. So basically, this would allow people to have, states would basically, there's a giant chunk that while there's like a national healthcare from Americare, it's not completely devolved. A lot of choice would be given to states and counties to figure out what's best for healthcare and what they need to do to help people, and maybe the federal government realizes what one state is doing is the best option. They could maybe incorporate that at a national level, but states have a lot of good power on what they want to do to help. So there's a lot of devolution of power, which within a healthcare policy. Though it's not completely devolved, as mentioned earlier, there's a national healthcare plan for everyone. So it's a mix of national and state power. And lastly, the next thing a right-wing, national conservative position on public healthcare should be is that a right-wing health policy would push certain social engineering on the American public. I know that sounds, kind of, oh no, but it has to be done. Now, I'm not going to ban you from getting a soda, right? But we must improve the general health of our nation. We must combat obesity, combat substance abuse. We must improve general health practices, such as exercise, in our nation. It's not just like, oh, do whatever you want. There's certain clear goals that we would prefer. Now, we're not going to ban you from, from eating a lot, right? But, because, that's going to be impossible to enforce, and Americans are not going to stand for that. But there is a way we could push for better health, policy. Now, we also need to stop subsidizing high sugar, high, fat fast food diets and move towards a culture like in certain European countries where there's smaller servings and less processed food that is more natural and fresh. We need to provide ways for Americans to become more active, with strong physical education throughout our high schools, more gym construction. Maybe there's a way we could help people get, gym membership. We in the cities when it's possible, we need more walking and bicycle paths, and and I would also increase sin taxes on alcohol, smoking, drugs, and fast food in general. Now, I'm not sure on the exact policies for how these goals would be achieved. I'm just kind of shooting the shit here, but on what exactly needs to be done. But what we need to do is, in terms of a health policy, is that Americans need to drink and smoke less, consume less, eat less processed food, and work out more. These goals must be explicitly clear for goals within the government and culture within a right-wing government and movement. So, all these, and that's why, as I said, like a lot of that, it would, that there's a, we want Americans from all walks of life to, improve on their health. But in terms of how exactly that's done on a policy basis, that might be, again, as I mentioned, the last thing is that this would be the responsibility of maybe at the state and county level. Maybe they could figure out a unique way of figuring things out. Also, along with this, is that we need long-term thinking within our healthcare system that improves it in the long run. Now, having a healthy populace would save money over time, because if people are going to doctors right now, it might be expensive at first, but if they visit, something, a doctor when they think something's off, then, maybe instead of waiting it out, like in the current system, where then they have to get treated for like stage 4 cancer, they get it nipped in the bud right in the way, so it's a much more cheaper, and people more healthier overall in the long run. So over the course of decades, people's healthcare would be a lot better. But also, this means we need to have nurse and medical school be more cheaper. In France, I believe they have it more subsidized. So we need more doctors and nurses. This means funding, putting massive amounts of funding into a, like a anti-cancer and anti-dementia and anti-Alzheimer's and other big kind of killers, trying to figure out ways to, improve, to kill, how we got rid of smallpox, for example. We need, to invest in general medical innovations and like devices and access expansion. Invest in drug, more generic drug research and development spending. We need a public health, where we combat diseases, where we have a mass immunization efforts like vaccinations. All these things would help the American public with health. And, we need to, find a way that provides people to be able to do that, without that, so that our healthcare system, so the American public is healthy, which is a goal in and of itself, but also to makes the our healthcare policy a lot more easier to manage. So that was my video explaining how I think a right-wing public healthcare system would work, why we need one in the first place, and why our current system is so broken and not serving the needs of our people. The public healthcare plan would provide healthcare to all of our people at cheaper costs, would improve the general health and welfare of our nation, and bring stability and security to millions of our countrymen. So, if you like this video, be sure to click that like, subscribe to my channel, and be sure to share this video around. Aim high, wander on, from America, with Russian love.